So a lot of what happens as a physical therapist in the career and just out in the job field is helping others. And pretty much you're just working with these people to try to get them better, whether it's mostly with movement.
On a daily basis, my normal job, I'm in an outpatient physical therapy clinic, and we see a lot of, our specialty is bone and joint injuries, orthopedic injuries. So your typical sprains, your strains, people hurt their back, hurt their neck, they're in a car accident. We'll see people after knee surgeries, whether it's ACL reconstruction, joint replacement. We'll see people before surgery or after surgery for a lot of shoulder injuries.
There are so many different routes and specialties you can take. You can become a women's health pelvic floor specialist. You can do wound care, which is people who have wounds that need to be constantly tended to. You can do cardiovascular and pulmonary specialties, which is people with heart conditions.
There's so many other options that you can do in physical therapy.
There are a couple skills that you want to have when becoming a physical therapist. One thing is be relatable. It's kind of doing your research and knowing different cultures, different backgrounds, and how to interact and relate to certain people. That is definitely one of, I think, the most important thing that you should be able to do. A lot of physical therapy is problem solving, and it's not doing it alone. It's working with other healthcare professionals. So being able to communicate is also an extremely important aspect of the profession. One last thing I would mention is writing skills, not necessarily writing essays, but be able to document accurately information that's presented to you and information that you recalled from experiences. It's just being able to document information accurately and exactly how it's presented to you.
You want to be well-rounded, but you want to focus on the sciences, biologies, chemistries, physics. You could take some of those in high school. You will definitely take them in college. You will be in class for a while, and then they'll send you out for several weeks in the clinic where you will be with a therapist, and they'll try to help you incorporate what you've learned and teach you some more stuff, but give you hands-on experience with the patients. Then you get back in for some more class time, and then I'll put you back out in the clinics again. So you spend a fair amount of time in the clinic, hands-on with people. I'll use like a knee replacement when they come in. They used to be in the hospital for 3 or 4 days. Now they move them out the next day. So when they come to us, generally I would have seen them in the hospital in a bed. Well, they're now in the clinic, and a lot of times they're in pain, and they sometimes are questioning, should I have done this? Because they're hurting, the knee is stiff, and to reassure them that now this is normal, it's going to get better. I'm going to start you out light, let's get you moving here, and encourage them to follow the doctor's orders with their medications and icing to keep the pain under control, and to see them gradually start moving. Where they came in and they were afraid, they're walking with a walker, wondering if I should have done this, and then in a week or two, I think I'm walking in with nothing, no cane, no nothing. Half the time I'm shocked and that they did it so early, but they're happy they want to get moving again, and just to see them progress and just, wow, I can do this again. Oh my gosh, this skill, wow, you're kidding, I can do that. I can go upstairs, I can pick up my grandchild. Yeah, that's fun to see the excitement in their eyes when they started out just questioning, oh my gosh, why did I do this? And then they realize, oh, this is why I did it. I don't have the pain I had before surgery. I can do things that I could do now I couldn't do before surgery. So yeah, that's fun to see them do that and just encourage them along the way, and to know, yeah, you're gonna get there. They don't believe you when they first come in, but you know, and you reassure them, and then they start to drop some of the fears and just forge ahead. So yeah, that's fun.
The impact that you can have on someone's life is amazing. People are so grateful because people don't like to be in pain. People want to be able to do what they love to do. They want to go hang out with their grandkids. They want to go play soccer. They want to go to the grocery store and not feel worried that they're going to be in pain. So definitely the impact that we can make changing people's lives, I think that's awesome.